G'day and welcome back to the channel. So in today's video, I want to show you something really cool. I want to show you how you can free up your lower back from the front. Now this is an interesting concept that I do a lot with my patients in clinic, where in the industry or in the medical field as a whole, we have a tendency to become very narrow focused or hyper focused on the area that is dysfunctional for you. So if you've entered into a clinic, you've come to see someone, you've got some lower back pain of any description, the tendency is obviously to be very focused on that low back. But what we know mechanically and functionally is that your body and your back doesn't just function as a back. It's obviously a part of your trunk and it's impacted by the things above and below that. And even that concept on its own, where we can treat above the spine and below the spine, that thoracic spine and those hips, we know that we can feed a lot more slack into the lower back by treating above and below. But one of the things I don't see commented on, or at least executed well enough day to day, is that we can also treat your lower back from the front. So this video is for anyone who has any type of low back pain. It doesn't matter whether it's a disc issue, a joint issue, it's a nerve root issue, whether you've got fibromyalgia, arthritis, doesn't matter what it is. We're going to look at you more as a broader mechanical being as opposed to an individual, segmentalized dysfunction. And not only is it good for any low back pain, but it's also fantastic for anyone who just wants their back to function better. So if you're someone who's struggling with a little bit of back stiffness, or it's just not working the way that you'd like, then give these exercises a go, because they're very simple exercises that have sort of cherry-picked to suit this video, but they're exercises that do a fantastic job of freeing up your lower back and treating your lower back from the front. So before we get into these exercises, and there's two that we're going to get to, YouTube has just released a new feature called a super thanks. You can locate the button or the icon just below the screen that you're watching this on. It's right next to the like or dislike button. What I ask is, if you do go on to enjoy this video, if you find this video helpful in any way, please let me know in the comments, obviously, but please consider leaving a super thanks donation. It's a great way to help this channel continue, helps me sort of pump out the content that I hope helps you. It's something that I want to grow into. I want to grow this channel into something special. So the more that you can help with that, the more you can help maybe buy me a beer or buy my wife a coffee, whatever you feel is best. Any of those considerations would be fantastic. So if you're going to enjoy the video, if you genuinely find it useful, please consider hitting that super thanks donation button, and I'd really appreciate that. So getting into the video, the important stuff. So again, treating your low back from the front, we can do that with two really fantastic exercises. And the first exercise is one that we've covered about a year ago on the channel, so we'll do another video updating this soon, but it's called the gut smash. Now, as far as I know, this was popularized by Jill Miller of Yoga Tune Up. She's an amazing yoga instructor. She's a very sort of forward-thinking professional. And the gut smash, from what I understand, is her baby. And what it basically means is you want to take a medium-sized ball. So this is a kid's soccer ball. You don't want it to be super pumped up, so there's a little bit of give in this. You can use any ball of about this size. What we're going to do is we're going to use the ball, we're going to press the ball into our gut, into the abdominal area, hence the name, the gut smash. We're going to lie down on our bellies, we're going to look around for any areas that feel tight, stiff, or potentially tender, and we're going to do a few techniques just to free those areas up. And as I was saying before, the way that I want you to think about this video is that we're not looking at you as a back, we're not looking at you as a disc or a joint or a nerve or a muscle, we're looking at you as a trunk. And part of that trunk around the back may be dysfunctional, but it might be dysfunctional because something around the front is also dysfunctional. And the way that your body functions is if it runs into something that is dysfunctional, it tries to find a way around that, and structures around that can become dysfunctional in their own right, potentially sore and uncomfortable. You can have some tissue damage, but in actual fact, it's because something very close to it is stiff, tight, or restricted, or it's not doing what it's supposed to do. So the gut smash is a great way to try and iron out some of those kinks. So all we need you to do is take your medium-sized ball, place it on the ground, and then we want to aim for the fleshy area underneath your rib cage, above your pelvic bone. Anywhere in that abdominal area is fair game. What we want to basically get you to do is we want you to move the ball around gently until you find you hit something that feels a little bit tight or tender. Now, we're not rolling around as an exercise, and again, if you're a fan of the channel, you know I'm not a big fan of rolling around on a ball. It's not specific enough to make that sort of really quick individual change. So what we want to get you to do is find a spot that feels a little bit tight and tender. So I found a nice spot here. What I want you to do is two things. I want you to take a deep breath into the ball And at the top of that breath, I want you to squeeze the area that feels a little bit tight. So we're going to get those abdominal muscles to activate. Again, it's that PNF model, that contract relax model. It activates the tissue so that when you breathe out and relax, that tissue then relaxes and gives a little bit more than it would. So you can stay on this spot for as long as you need to. So do another deep breath. Give it a squeeze, hold that for a few seconds, then relax. And then basically you can move on to the next spot. So again, anywhere all the way down to just above your genitals, around where that pelvic bone is, anywhere inside of it is a great place to look. Make sure you're looking on both sides. Spend some time trying to free up those areas. And as I said, it's a fantastic way to unglue some of that restricted tissue at the front. Now, the other benefit of that is because we're in this area has the vagus nerve, and the vagus nerve is part of the mechanism that helps our nervous system and our tissue down regulate. So if you're someone who's got chronic low back pain, or your low back pain is quite severe, maybe it's a 4 or a 5, a 6, an 8 or a 9 out of 10, doesn't matter how bad it is. By down regulating that nervous system, we can start to cue your body into feeling a lot safer and a lot more relaxed. And often what we see clinically is that can bring that sort of pain level down as well. So not only are we freeing up the back from the front and feeding some slack to that back to make the back function better, but we can also get a lot of down regulation or destimulation of those nerves to bring that sort of pain sensitivity down as well. So the gut smash is a fantastic way to influence your low back pain. And after doing that, you should genuinely feel like your back is moving a little bit better. So that's exercise number 1. Exercise number 2 is a personal favorite of mine. I cover this a lot on the channel. So again, if you are a fan of this channel, you will see this and how important this is. But the second exercise that I want to go through is the couch stretch. Now again, ideally you would do this on a seat or a chair. But if you're a beginner, I would advise you to do that. But if you're more advanced and you're looking to push this a little bit further, doing it up against a wall on the floor is a great way to do this. It's a punishing exercise potentially. So if you do have genuine acute low back pain, please start in a chair, work your way into this, choose a level that you feel very comfortable with, and then ease into it the more it starts to give and the better it feels. You'll know specifically how far into this stretch you can go. But the purpose of this stretch, or the way to do this stretch, is you want to take your knee, you want to place that knee right into the back corner of whatever you're on. So if you're on the ground, you'll be right in the back corner of the floor where it meets the wall. If you're in a chair, you'll be where the back of the chair meets the seat. And then what we want to do then is we want the other foot to come up. Now again, this is going to be a lot easier if you're in a chair. And if this does feel uncomfortable for your knee, you're welcome to put a pillow or something underneath if you're doing this on the ground. In an ideal world, you're actually going to be putting the pressure above your kneecap. You're not actually going to be down on the kneecap, so you want to make sure you're really in there so that when you come up into this high kneeling position, you'll feel like the pressure's above that kneecap, so it should feel comfortable without anything for a lot of people. But again, if it does, feel free to put something underneath. Now, as I was saying before, if you do have some genuine back pain at the moment and you're trying this stretch out, start down very low. And then all I want you to do is drawing your belly in, squeezing the butt cheek of the side that you're stretching. I want you to just gently come up from your hips as far as you feel comfortable. Now, in a perfect world, you'll be able to get relatively vertically and feeling comfortable here. You can take a deep breath, you can talk, you can laugh. You're not going to feel like you're going to vomit and pass out. But if it's very restricted through here, which it is for a lot of people, then just come up as high as you feel comfortable, where you can tolerate this stretch for a period of time. Because what we want to do here is we want to hang out here for a little bit, but again, with that butt squeeze, with your belly drawn in, we want to tense the muscle that feels tight. So the benefit of this couch stretch, the reason why the couch stretch is such a fantastic exercise to do, is that it attacks the hip flexors at the front of the hip. Now, a lot of people don't realize, but the hip flexors, or part of the hip flexors, or one of the hip flexors, attaches from your thigh into the front of your spine, particularly that low back. So if you're having any low back dysfunction, if you're having any restrictions in your lower back, often that hip flexor, that iliopsoas muscle, is tight and restricted, and it's impacting your spine from the front. But it's often not painful in its own right, it's just restrictive. So an exercise like the couch stretch, when you're up nice and tall, or as tall as you feel comfortable, is a great way to open up that the front of the hip, feed some slack into that low back from the front. And again, you can turn around and change the position that you're in to see which version of this stretch is the best for you. So when I rotate sort of away from the side that I'm stretching, I genuinely feel a nicer stretch to the front of this thigh, the front of the hip. Now what I want to do here is Again, similar to the gut smash, we want to get you to take a deep breath in and then tense those muscles that feel tight. So you can push your foot back into the wall or the back of the chair, flare those muscles up, make them work for a few seconds. Then when you relax them, this should be a relatively more tolerable position. And then again, we just want to keep repeating that process as much as you can or until you sort of stop making change. But the benefit of that stretch is immense. And again, you should feel obviously that hip flex is freed up, but then again, you should feel like your lower back has freed up a little bit as well. So again, it's a unique way to address low back pain and low back dysfunction, but it's not something that I see talked about much at all on YouTube. At the very least in my profession, we're very much focused on the back, which is fair enough, but to be very thorough and to be very elite at treating your low back pain, if we're not having a conversation about your hips, which we've spoken about in a previous video, if we're not talking about your lower thoracic spine, which we've talked about in a previous video, we obviously need to talk about your low back because that's where the action is. But if we're not putting all those pieces together and also addressing what may or may not be going on through the front of your trunk, then we're missing the bigger picture. And if you're trying to be someone who used to have low back pain and you fix that back pain for good, we at least need to tick these boxes off to make sure that these areas are functioning well, and the gut smash and the couch stretch are two fantastic ways to do that. So as I said, if you enjoyed that content, if you found it useful, please leave a like below. Please consider leaving a super thanks as well. I'd really appreciate that. But again, subscribe to the channel if you're new, if you enjoy this content, if you want to be along the journey with me. I have big plans to make this one of the best physiotherapy or physical therapy based channels on YouTube. And Instagram as well, wherever I can sort of post this. I want to make sure as many people see this stuff as possible. So I can't do that without you guys. Hopefully you get enough out of this that you want to join on that journey with me. So with that being said, thanks for watching. I hope they help, and I'll see you in the next one.